Welcome to another episode of Cutting Edge Health. Today, we're talking about stellate ganglion blockade and why ultrasound is the best medical practice. If we haven't met, I'm Dr. Orlando Landrum, and I'm here to tell you about different options to be able to help you punch pain in the face, whether it's physical or mental, and get back to leading the life that you deserve. So today, we're talking about a special procedure that's called a stellate ganglion blockade. And the reason why I'm doing this video is because what we start off knowing doesn't always mean that that's the way things are as time goes on. Interestingly enough, as a young resident, I was taught how to do this procedure, which is called a stellate ganglion blockade, right? It has a number of different indications, which we're going to explain and go into depth and detail about. But at the end of the day, how I was initially taught how to do this isn't necessarily the best way to do it any longer. And so we're going to explain that, get into depth and detail so you can be able to follow and understand that. So let's talk a little bit about what does this entail and what could this be used for? So when we're looking at a stellate ganglion blockade, traditionally we're looking at this cartoon gives a representation of being able to take a look at the neck and be able to see the vertebral bodies, the discs that are in blue, and the artery that's associated with that area, which is the common carotid artery, as well as the nerves that are in and around that area that come off from the cord that become the brachial plexus and nerves that go down into the arm. And down here at the bottom component, you can see that there's something that's called the stellate ganglion. It sits in and around these various different arteries, around the nerves, close to where the spinal cord is, and those things are kind of important. So historically, the way that we used to do this blockade is we would target certain areas of the spine by going after it using X-ray alone. And that may not be the most optimal any longer. So what could this be utilized, and why would you even consider doing a procedure that has such a degree of potential high risk? Well, it's useful because it can be able to help things like this. So if you're to look at how this limb has been injured, and you can see that there's a redness and a change in terms of it being very full and fluid and really edematous is what we would use in terms of being able to kind of describe it. That type of issue can cause pain. And that pain historically has been something that's called complex regional pain syndrome. And in looking at that complex regional pain syndrome, we used to treat this with something that's called a sympathetic blockade. And that sympathetic blockade is targeted towards certain nerves that are present in different parts around the body. Another example of this type of potential problem is a foot like this, where you can see the swelling and just changes in the skin coloration and how full it is from fluid, which is edema, right? So those type of treatments that can be able to improve that and get it back to normalcy has historically been significant in being utilized for treatments that target sympathetic nervous system. And so sympathetic nervous system is different than our traditional nervous system. Our traditional nervous system can be under voluntary control. It means it allows us to be able to move fingers, it allows us to be able to talk, it allows us to be able to do things like that. Well, the sympathetic nervous system is controlled and normally is focused on activities that we don't actively have to control. So how frequently do we blink? Things like our heart rate. How does our gut be able to move food through? So those things that are kind of normally not something we're actively trying to control, but are on automatic function, the sympathetic nervous system controls. And so when that system is awry or altered, it can give a number of different problems. There are ways to be able to intervene and make it better. And we've talked about some of those things before, everything from traditional invasive neuromodulation like spinal cord stem in a traditional sense or dorsal ganglion, to us being able to do non-invasive type therapies like transcranial magnetic stem, and ways to be able to modulate the nervous system as a whole. But this particular context is by targeting that nerve in that one section. When we originally started doing this, and the dates kind of vary, but somewhere in the 1920s to 1940s, what we thought was we are just treating this and it's going to help us for the shoulder and the arm and maybe some components of the face and neck in terms of head pain. What we've kind of learned since is that it's way more complicated than that. And the way that these can be able to kind of improve conditions is much more varied than what we thought, even as recently as about 10 to 15 years or so ago. So that nervous system I make reference to is the following. The sympathetic nervous system, as you can see on the left-hand component of this picture, can do everything from changing your pupils to decreasing the amount of saliva that you have, to increasing your heartbeat, to dealing with moving your gut through, to dealing with glucose production, to bladder constriction, to various different other elements that are in place. It's frequently part of the fight or flight component, and it has a number of different things like neurotransmitters that influence its utilization and how well it works and how well it doesn't work. And that's an important point coming up in a little bit. And one of the reasons for that is because as we have changes that are present, we can see that it can cause either upstream or downstream regulation. So upstream regulation can be things that have changes that take place in the brain. And it's one of the reasons why we think that stellate ganglion can be useful for other elements, particularly things like PTSD, anxiety, and potentially depression. And so some of the things that we see is we can see changes that take place with the gray matter, with how well the brain talks to itself, and how those things influence the metabolism that are present in the brain. And there's different structures in the brain that change, both with the aspect of PTSD as well as with complex regional pain syndrome, that this particular treatment can be utilized to provide value. So getting into kind of the semblance of, so what are some of those things and how do those potential other things outside of pain, this from one of the papers talks about this. So one of the things that is a little unusual is for those individuals that have potential PTSD, those individuals that have changes with their sleep, potentially problems that have post-COVID syndrome, chronic fatigue, even hot flashes that are associated with menopause or arrhythmias that are present with the heart can all be improved and fixed to an extent by this type of treatment. So how does this happen, or what are the mechanisms behind how this works? Well, this actual slide kind of shows that. So without getting too fancy about this, I got to take a quick divergence for just a second and tell those individuals who didn't watch our live stream from last week, I was at a conference, and I was at one of these conferences, and I posed it to a doc, and the doc was basically like, no, you just do this procedure and it resets the brain, and that's just the way it works. Well, to kind of put it nicely, the best way I can kind of say the response to that would be is wrong. To an extent, yes, but to a further deeper extent, no. There are things that are actually much more complicated than that. And so some of that complicated component is it changes different pieces that are present with how the nerves respond, as well as how they relate, as well as how they store information. So one of the things that you can see is this NGF, which stands for nerve growth factor. The other thing you can see is this NE, which is norepinephrine, which is present within the aspect of the endocrine system. And those things influence how you have changes that take place with stress, and how stellate ganglion blockade can change those things for the better. So you get this sprouting in a bad way of nerves that can communicate in a way that shouldn't be the way that they are. And a stellate ganglion can be able to improve that treatment. So what are the details on that? And I'm telling you all this to give you the rationale for why stellate ganglion blockade can be useful, broader than what we thought even a few short years or so ago, and why it's worth the risk that we're going to explain how to be able to decrease that risk no matter where you are, so you can talk to your healthcare provider about how to do this safely and be sure that you get a good outcome. So one of the papers that looks at different ways that stellate ganglion blockade can be able to provide value is this paper that looks at a whole host of different things. What they looked at was for traditional pain, it can be useful for migraine. It can be useful for cluster headache. It can be useful for shingles type pain, which we've talked about. So head, face, and neck, the fancy term being postherpetic neuralgia. It can be useful for postoperative pain, particularly for those patients that have head and neck cancer. It can be useful for peripheral artery pain. And as mentioned before, for complex regional pain syndrome. So we knew that right off the bat, right? We've talked about that. We've had it in other videos that have been present on YouTube and Facebook, and you can reference that. But some of the other things that are a little bit unusual are the following. So it can be useful for endocrine disease, right? And so for those people that have hot flashes, those people that have night sweats, it can be useful as a potential treatment option when historically there aren't a lot of good treatment options. And the way that it influences that is from that slide that I showed you before, is it can change nerve growth factor. It can reduce that application and synthesis of norepinephrine that we talked about before, and how that is influential to the brain. It can be able to regulate sweat glands by using those type of processes. In addition, it has been useful, as stated, for psychological type treatments, which one of the first evaluations for that is from 1947. So it's not something that's new. It's been out there for a little bit. That's been helpful for things like PTSD. And initially it was utilized in the context of being able to try and improve someone who had that complex regional pain syndrome, in addition to them having PTSD at the same time. They saw that there was improvement for both. By the way, those of you who are joining us live, I really appreciate you guys. Thank you so much for joining us as traditional as you have done with some degree of frequency. We really appreciate your support. It also has been useful for things like sleep disorders that I made mention of before. So those patients that have changes with what's going on with their pineal gland and melatonin and sleep and awakening, it can be able to help improve that dysregulation by improving different components that are present in the brain. And then finally, and this one is a little bit unusual, most people wouldn't think about this, we're doing a treatment that's present in the neck that historically has been targeting the nerve, and we can see it can be able to provide improvements with issues with the immune system. So the norepinephrine that can be produced will suppress immune responses, and that can be modulated potentially by the use of something that's called a stellate ganglion blockade. So all that said, so what's the traditional way of potentially doing this? The historical way was to do it blind without even using imaging at all. But probably for the last 20 to 30 years, it's been utilizing X-ray to see where the areas of the spine exist. Then you feel with a finger where the carotid artery happens to be, and you pull the carotid artery off to the side, and basically you kind of palpate that area, and then you take it down to the area of the cervical spine, and there's a number of different levels that are associated with it. But at the end of the day, what you do is you find that area and you place a needle right in the front portion of it by avoiding the artery, right? Because we can feel the artery. Well, there's some problems with that. And let's talk about that. So first and foremost, when we place a needle into around those areas, we can be able to identify where the skeletal structures are. Facts, no doubt about it. But what we can't identify is those things that don't show up on X-ray, and there are quite a few. So the reason why you want to consider this under ultrasound is when you put an ultrasound on, you see the following. You see all of this. So you can see the bright red arrow in the demarcation of it saying this is where the stellate ganglion is, right? The different standouts for what these things are. So SCM stands for sternocleidomastoid mastoid, which is a muscle that sits there, and we can typically be able to see this. The carotid artery, which is CA in this particular picture, is what we moved to the side. The IJ stands for interjugular, which sometimes you can't feel and palpate that, and you would think it's in one area, but it's not always there. TH stands for the thyroid, and that thyroid, sometimes getting into that tissue can be problematic. And then you have this picture that's the LC, and that stands for longus coli, which is a muscle that exists there. But there's a few other structures that we're going to talk about that can get into and cause all kinds of problems that, if it's not done under ultrasound, can be a bit problematic, to say the least. So what are some of the symptoms that you can have? Some of the symptoms that can occur are the following. And some of these things are normal, and some of these things aren't so normal. So if you were to take the adverse events that would occur from doing a procedure like this, frequently you can get a hoarse voice. And that's the reason that we kind of expect, because you can get into in and around the area that's called the recurrent laryngeal nerve that supplies our vocal cords. And because one of those areas can not have the proper traditional functioning, it can cause you to have some hoarseness. We expect to have some drooping of the eyelid and some challenges potentially with swallowing, but those things are associated with us treating the sympathetic nervous system. But as you look down this whole thing, you can have numbness in the hands and wrists, which is not necessarily normal. You can have twitching of the eyes. You can have a tingling sensation. You can have chest tightness. You can have other things that result because we've gotten into areas where we shouldn't necessarily be. So this particular paper that we're going to talk about next talks about that very thing. And so it's ultrasound guided stellate ganglion blockade successfully prevented esophageal puncture, which is by one of the most premier docs that really has kind of advanced the field, a doctor by the name of Naruz, who really started stating, well, maybe when we do these injections under regular x-ray, the only thing that we see is that bony area, right? That's it. That's all we get. But we don't know about the soft tissues like we showed in that one pictorial representation before. And so if we were to do a cross section of the neck, we can see this x-ray initially, right? Which just shows a normal x-ray. But if we take a cross section, the cross section looks like the following. So we would just see C6 that you can see that vertebral body, but you got the trachea, you have the esophagus. And as mentioned, there are other structures besides the carotid and the areas of that internal jugular. The areas we also have to be concerned about are areas like the vertebral artery, which is this other little red structure below the first red structure. You also can get in and around the nerve root and into the area of the cord if you're not careful. Particularly the local anesthetic can get into the area. But when you use ultrasound, you can see a lot of these different tissues, such as the following. So here we have a similar type pictures we had before. And I know some of this is kind of like garbly-gook and people are like, what the heck are these pictures? What are you showing us? We don't kind of get everything because it looks super complicated. But I'm going to tell you, I'm going to explain it so that you can be able to follow along and you get exactly what it is that I'm trying to explain to you. And you can feel like you're not getting left out. All right. So this picture is, instead of it looking like kind of a baby that you'd have under ultrasound, it's a picture of the neck and it shows the following. So kind of giving you those identifications with all the different acronyms before. The CA on the right-hand side of the picture is the carotid. To the right of that is the internal jugular vein, which is that IJV. To the left of that is the thyroid, which is TH. To the left of that, the TR is the trachea. And then we see something interesting. It's called ES. And ES is the esophagus, which we do not want to get a needle into the esophagus. It can cause a whole host of different problems and issues. The LC is longus coli, and there's other areas that sit in and around there that other muscles called longus capitis. But if you don't know what you're looking for under ultrasound, it can get you into a world of trouble that can cause problems and issues. But at the end of the day, as a patient, what you want to be able to do is to talk to your provider and talk to them about an ultrasound utilization of treatment so that you don't kind of get into areas that you wouldn't normally expect. So traditionally, when we think about doing injections, we expect for the anatomy to be the anatomy that's in the textbooks. But unfortunately, that's not the way things work. Sometimes when we expect for a structure to be on one side, it actually will show up on the other side. And if we don't have imaging to verify that, we won't know until it's potentially too late. And there's consequences to injecting into structures that aren't prepared for this. So one of the other things is that there's actually an inferior thyroid artery that exists that's in and around the areas of the thyroid and close to the stellate ganglion. If we inject into that, it can cause all kinds of problems. And the only way to be able to see it is to be able to see it under ultrasound. So as a quote unquote public service announcement, we want patients to understand when you're getting a procedure that there's a whole host of different reasons for why you would want to do that stellate. It can help you, as mentioned before, for pain. It can help you for PTSD, anxiety, and depression. It can help you to be able to improve arrhythmias. It can help you with sleep disorders. It can be able to help you with the areas of being able to deal with endocrine dysfunction and things that take place within that regard. So there's a lot of different reasons and a lot of research that's combining this in conjunction, but we want to do this in a safe way, in a safe manner. So hopefully this video was helpful for you to say, at the end of the day, x-ray is probably not our treatment alone. At the very least, we should be using ultrasound and maybe the combination of them both to get a safe outcome and something that improves our overall life that can be able to help you punch pain in the face and get back to leading the life that you deserve. Thank you again for joining. If you have questions or comments, please leave them in the section. And we look forward to having you join us again for another video that helps explain your choices and options to you. Thank you so much and have a great day.